Hello, this is Amy Schreiber, NCOL Content Manager, and I'd like to welcome our listeners to today's podcast session. We are pleased to have Doug Sherlock, Senior Healthcare Analyst for Sherlock Company, joining us today. Doug is here to give us his quarterly insights into financial markets of health plans.
Thank you, Amy. In this broadcast, we'll review the performance of the managed care industry for the second quarter of 2020 and year to date. We'll also discuss sector valuation indicators and operating trends. First, I want to speak to stock prices and valuation. As of May 12th, stock prices for the publicly traded health plans are up by an average of 7.8% since the beginning of the year. This compares to the 4.6% increase in the broader market measured by the S&P 500. Health plan sector market capitalization increased by 2.9% year-to-date since the increases skewed towards the smaller plans. On January 23, Centene announced that it completed its acquisition of WellCare, so for comparison purposes, our universe is comprised of 7 publicly traded companies. Stock prices for 5 of the 7 plans gained ground so far this year, led by Molina at 41.4%, followed by Humana at 14.6%, and United at 9.6%. Centene gained 3.5%. Triple S increased by 1.6%. Anthem and Cigna fell by 6.2% and 9.9% respectively. Here you can see an additional facet of the relative performance of the plans. While those focused on the commercial market were weak, those focused on Medicare and Medicaid appreciated. This was a similar trend to that of the first quarter of 2020. Valuation metrics were mixed since the beginning of the year, with price to trailing 12 months earnings increasing by 9.5% to 17.2 times, price to projected 2020 earnings lower by 3% to 14.2 times, price to operating earnings decreased by 10.8% to 15.2 times, price to sales gained by 1.6% to 0.68 times, price per total member increased by 7.4% to 3,300, and price per risk member increased by 3.9% to 5,400 per member. All rates of change are calculated holding constant the universe of health plans in both periods. Since our last podcast in May, the average health plan stock prices are higher by 9.9%, with health plan market capitalization increasing by 7.1%. The S&P 500 gained 8% since May. Health plan valuation metrics mostly trended higher except for price to operating earnings. Price to operating earnings fell by 10.8%. However, price to trailing 12-month earnings was higher by 10.3%. On to our review of operating trends. For the second quarter of 2020, combined ASO and risk membership increased by an average of 7%, while increasing by 5% in total to 137 million. By average growth, I mean the average of each health plan's growth rate. By total, I mean it reflects the change in the combined membership of the plans as a whole. Fully insured risk membership increased by an average of 9.8% and in total by 9% to 77 million. Medicaid plans experienced an average increase of 24% and total growth of 35% to 21 million members. Commercial plans reported a gain of 4%, increasing to a total of 56 million risk members. The total increase for commercial plans was 2%. Centene reported the largest increase at 43% due to the acquisition of WellCare. If this acquisition was not included, Medicaid growth would have been 4%, and Centene's growth would have been 3.5%. Again, you can see the difference between commercial, which grew considerably slower than Medicaid. The proportion of total members served under self-funded ASO arrangements fell by 2.4 percentage points to 43.8%. On average, the plans posted a 1% decrease in this membership. ASO membership was down by 0.2% to 60 million. Revenues for all plans increased by 15% and in total by 14% to $152 billion for the quarter. Medicaid plans reported $32 billion in revenues with an average increase of 31% and a total increase of 44%. Centene posted the largest increase in revenues for Medicaid plans by 51%, in part attributable to its acquisition of WellCare, as noted previously. Commercial plans increased by an average of 8% and in total by 8% to $120 billion. Humana posted the largest increase in revenues of 18% to $19 billion. Again, Humana is focused on the Medicare Advantage business. Premium rates for all plans grew by an average of 4%. Medicaid plans and commercial plans experienced an average premium growth of 6% and 3% respectively. Note that premium rate growth does not adjust for changes in product mix, demographic factors, or benefit design changes within the products offered by these plans. Operating earnings surged. For the second quarter, they were $18 billion, a total increase of 129%, and an average increase of 108%. In other words, they more than doubled. Medicaid plans reported earnings of $2.4 billion, an average increase of 139%, and a total increase of 170%. Commercial plans also gained ground to $16 billion in operating earnings, an average increase of 95%, and a total increase of 123%. Centene had the largest percentage gain for all plans of 203% in operating earnings to $2 billion. For commercial plans, the largest percentage increase was Anthem, with an increase of 140% to $3.3 billion. Central to the increase in operating earnings was the sharp improvement in operating margins. Average operating margins for all plans increased by 4.7 percentage points to 10.5%. Medicaid plans posted a 3.5 percentage point increase to 8.1%. Commercial plans margins were higher by 5.2% to 11.4%. The health benefit ratio for all plans declined by 75.5%, a decline of 8.1%. The average health benefit ratio for Medicaid plans decreased by 5.3 percentage points to 77.1%. Commercial plans had a 9.3 percentage point decrease in their health benefit ratios to 74.9%. In our experience over the past 3 decades, we have never seen a year-over-year improvement this sharp in health benefit ratios. On the other hand, the average administrative expense ratio grew by 3.6 percentage points to 13.5%. Medicaid plans reported an average increase of 1.7 percentage points to 15%, while commercial plans experienced a 4.4 percentage point increase to 12.9%. As discussed in the last MCOL call, the resumption of the health insurance provider fee is part of this, but the administrative costs of the disruptive knock-on effects of COVID-19 may also have played a role. Non-operating earnings fell by $690 million. Our calculation of non-operating income is the sum of investment earnings, income earned in non-health lines of business, less interest expenses. Medicaid plans reported non-operating losses of $80 million compared to a gain in the prior year's quarter of $31 million. Commercial plans experienced a total decrease of of $579 million to $660 million. Net earnings for the second quarter were higher for the plans, increasing by an average of 81% and in total by 92% to $14 billion. Medicaid plans net earnings of $1.5 billion, a total increase of 113% and an average increase of 93%. Commercial plans generated $12.4 billion in net earnings, a total increase of 90% and an average increase of 77%. Centene had the largest percentage change in net earnings, 136%, from $509 million to $1.2 billion. This was primarily due to that $1.3 billion increase in operating income. We normally don't spend much time discussing health plan working capital, but these are unusual times. Accounts receivable increased from 31 days to 40 days as customers paid later. We assume this is due to extended grace periods, sometimes at the demand of state governments. Importantly, since accounts receivable are after the effect of write-offs for bad debt, they implicitly assume in this uncertain environment that the plan will ultimately get paid. Accounts receivables are estimates, and they are truly without much relevant experience to build upon. Interestingly, the average age of a claims payable also increased from 75 days to 85 days. This is even more tricky to understand for external users of financial statements than accounts receivable. It may be that plans are being more conservative in their accrual assumptions since they cannot know what they do not know. If so, this could lead to improved earnings once this conservative assumption is unwound. Or it may be that they are simply slowing down payments to providers. I want to close by touching on a key environmental factor. Our presentation today is the first with an entire quarter reflecting the knock-on effects of COVID-19. Recall that the initial weekly claims for unemployment insurance averaged 212,000 through March 7. On the week of March 21, these claims exploded to 3.3 million and peaked the following week at 6.9 million. While this morning's report of 963,000 was far lower, the level of insured unemployment remains high. Through March 7, insured unemployment averaged 1.7 million people and peaked at 24.9 million people on May 9. It is now 9.4 million people lower at 15.5 million. Happily, improving trends are beating expectations. Nevertheless, unemployment is quite high, and this can be expected to have a bearing on all levels of health coverage and the product mix of plan offerings. After all, most people receive their health coverage through employers, and unemployment is up. By the same token, Medicaid is often available to those who have lost jobs. So, health plans both experience negative effects on their employment-based membership, but also a shift in favor of Medicaid if they offer this product. As we mentioned last time, we expect Medicaid and Medicare Advantage will have an increasing importance in the product portfolios of these companies. One result of this was the surge in the administrative expense ratios for these plans. In response to this, Sherlock Company provided models at no cost to its clients to enable them to adapt to changes in scale and mix. Simplified versions of the scale model and the mix model can be found on our website. I invite you to give them a try. Please reach out to me if you can't locate them. If you have a license, been a licensee or participant, please reach out to me so we can get you these flexible models of cost and staffing. Anyway, to return to that sharp increase in administrative costs, its surge would have diminished earnings by more than 60%, except for another knock-on effect of COVID-19. Hospitals were encouraged to limit elective care. This drove down the health benefit ratio greater than the increase in administrative expense ratio, leading to a doubling of operating earnings. Whether care not delivered during this restricted period will return because it was deferred, or because it failed to preventatively diagnose and treat what will ultimately be much higher health requirements, is anyone's guess. In this uncertain environment, the most manageable activities are those under the direct control of health plan managers. For most health plans, these activities are administrative, that is, fielding calls from providers and customers, processing claims and enrollment, conducting medical management, and risk management in an effective and efficient way, plus assuring the information system infrastructure is optimal. Put a different way, optimizing administrative expenses improves performance under any scenario. The Sherlock benchmarks may provide you the insight that you need to achieve optimal costs in this volatile environment. If you're interested in any of our universes, please reach out to me. These universes are Blue Cross Blue Shield, independent provider sponsored, Medicare, and Medicaid plans. As always, you can get a transcript of these remarks through MCOL or Sherlock Company. We look forward to hearing from you. This is Doug Sherlock of Sherlock Company.
You've been listening to Doug Sherlock share his quarterly insights into financial markets of health plans.